Good day to everyone. Welcome to our second episode of Vitalyse Programme. Today, it's our pleasure to have Dr. Liew Kean Chiew to join our program. Today, we'll be discussing ovarian cysts with Dr. Liew. Welcome, Dr. Liew. Thank you for gracing today's episodes and being our guest of honor.
Hi everyone, thank you for having me to share some of the experience to you all.
As we know, ovarian cysts are common to women, especially with those ill at periods. Dr. Liew, what is an ovarian cyst and what are the common symptoms?
Very common questions that always posed to us about what is ovarian cyst, and it causes a lot of anxiety to women. Basically, you can see I show you this model. Ovarian cyst is a growth means something happened inside the ovary from here, now it's here. And as a woman, we have two ovaries, alright? So sometimes it can grow from one side, we call it unilateral, or sometimes both sides as well. And most of the time, ovarian cyst is non-cancerous, as most big women will feel very anxious about it because it could be cancerous, alright? And as you know, most of women may not have any symptoms when they have ovarian cyst, and they only know that when they go for a routine medical checkup and then do ultrasound and found that they have ovarian cyst. However, having said that, some may experience some symptoms because of ovarian cyst. Some may have some pain, some may have some menstrual disturbance, it could be heavy, it could be irregular, or sometimes they have pain when they have sexual intercourse, especially for those who marry. So there are various types of symptoms in presentation of ovarian cyst.
What is the main cause of ovarian cyst, and do ovarian cysts make the period worse?
The exact cause of it remains a mystery. However, there are some who runs in the family, especially the cancerous type. Most ovarian cysts exist without disturbing the menstrual flow, except in certain types of ovarian cysts where it produces female hormone, and some elderly women may have unexpected menses.
Dr. Liew, when should we seek medical treatment?
If you have symptoms or discover that you have ovarian cyst, you should consult your doctor immediately, not to wait tomorrow or day after tomorrow.
How can ovarian cysts be shrunk naturally?
Unfortunately, most ovarian cysts can't be shrunk by any forms of medication. Most would need some form of surgery to remove it or reduce the size. But there are some cysts who can actually resolve by itself, especially the small one. So we have to see the size of it and determine what to do.
What is the difference between ovarian cancer and ovarian cyst?
Generally speaking, both can be considered tumor of the ovary, which means a growth arising from the ovary. Ovarian cancer tends to grow bigger over a short period of time, and it can spread to other parts of the body like lungs, our gut, even our brain. Where ovarian cyst is benign, is non-cancerous, and it does not behave in such as cancer ovary.
What are the typical treatment options for ovarian cyst?
Well, depending on the type, the size, or the symptoms of the patient, most ovarian cysts can be observed over time without needing any surgery. Now, with the advancement of medical technology, majority of the surgery can be done through a laparoscopic surgery, what normally people say is a keyhole surgery. This type of surgery confers a better recovery and a less painful.
What happens during the initial surgery?
The surgery is typically performed with the patient is given general anesthesia. 3 to 4 holes with a size from 5 to 10 mm pots are inserted into the tummy. Carbon monoxide was used to instill into the abdomen, and a camera is inserted to see the content of the abdomen. The surgery generally takes about 2 to 3 hours, and the patient will normally discharge the following day. The recovery time is much faster compared to the conventional surgery.
Here are some questions from Facebook. Let's take a look.
Definitely, endometriosis is one of the common causes of ovarian cyst. It has the typical features during the ultrasound, which show some ground glass appearance. And I will have to say that majority of the cysts we encounter during the daily practice will be cysts caused by endometriosis. Normally, we treat endometriosis when the patients have symptoms such as pain during menses, or abdominal distension, or pain during sexual intimacy. The treatment of endometriosis can be either medical or surgical. Medical means that giving drugs to the patient, either it is hormonal orientated or pain relief medication. But for surgery, most of the time we are doing a laparoscopic approach to remove the endometriosis and to destroy the endometriosis as well. A very quick questions. Well, generally speaking, we try to avoid a second surgery for those who have endometriosis. There are many options available for patients who have undergone a laparoscopic surgery and developed again endometriosis. Majority will have used a medical therapy like hormonal or some form of a pain relief. But if these options is failed, then a repeat laparoscopic surgery can be considered as an option.
Alright, thank you Dr. Liew for spending your precious time with us. That's all for today's episode. We hope that we have done enough enlightenment in this particular topic.
Should you have further inquiries or concern, please do not hesitate to make an appointment with me. You can now make an appointment using our Pantai BGMs. Alternatively, you may choose to have a video consultation with me from home. Just register on our eHealth portal to make an appointment.
Goodbye.
Bye.